Hi, I'm Dr. Srinivas. I'm a consultant neuropsychiatrist in Max Cure Hospitals, High Tech City. Now I'd like to talk about few things, the childhood emotional problems. To start with, these days, because there was a lot increase in the awareness and you could see a lot of paradigm shift from the schooling, like from a public schools to international schools. All children are being under screen now. So you could see your kid is kind of getting screen on and off and being more analyzed both psychologically and medically each and now and then to identify the issues. So good to see these kind of things happening at a very grassroots level in understanding the dynamics of the child growth. Everyone knows the child has to pass through a lot of milestones in his journey to be able to turn into a good adult or a mentally fit to a physically adjustable. So you could see a child when he's going through different phases, like from its social interactions to his cognitive functioning, the way he's been thinking about to his psychosexual development. So there are different milestones in a childhood when we relate to the childhood emotional issues. So these days I could see a lot of kids coming around age from 5 to 10 saying that the kids have been suddenly showing tantrums or getting too irritable to sit at one place. He's becoming too nervous to actually to interact or have an eye-to-eye contact with the peer group around, and kind of getting too belligerent or too much losing the control over situation. So, and besides all this, you could see these days children are becoming too lethargic, too inactive sometimes, and contrary to this, even there are kids who are becoming too hyperactive. Seeing all this, you might be wondering why this, are they being too much overrated symptoms as per the teachers, or it should be given an importance, or at what level it should be considered. As per the many scientific evidences, you could see to that the raise in this emotional issues, the childhood emotional issues are kind of getting into the situation, given more important. The reason being this disruptive childhood reaction disorders, disruptive childhood emotional disorders. Because these have a very clear roots to the genetic, to much of idiosyncrasy. So the most of the kids around 6 years these days, I could see a lot of imbalance because of the way they're thinking, the way they've been understanding, the gaps in their understanding, because of the lack of their attention and sudden outburst which is turning too violent to the parents to control them, and they becoming fall because of the lack of intelligence sometimes, the borderline intelligence, which is also kind of challenging the kid to actually understand and be in a line with the other peers group. So today I would rather give you why this childhood emotional disorders and to what extent this might be actually an issue. The most important is these childhood emotional issues are as I said, more genetically linked and has been actually as a high comorbidity with a lot of hyperactive disorders to pervasive developmental issues. And besides all this, even a lot of medical comorbidities also could actually causing this disruptive emotional thinking problems in children. These emotional issues normally these kids a lot fall out in the classrooms, and they have a poor scholastic performance, and it's very liable, these kids at home behave in a different tone, with a different emotional tone compared to when they're in the school. So the frequent teacher-parent meetings also could actually identify these issues at a root level. And the curriculum based also, it should be clear that the kid wouldn't identify the aggressiveness, his own markings in understanding, and he should be given the liberty to modify or kind of adjust to the curriculums. Otherwise, this also kind of increasing the demands, also causing these emotional problems. And nowadays, you could see these bipolar changes, like the kids even expressing too much saying that they don't want to stay at home, they're being not given that priority, they are not treated equally with other siblings or with other peers. So these kind of awareness or these kind of things, the child, when they are expressing, it is a clear sign that is getting this disruptive thinking. This leads to more emotional reactive disorders. Coming and identifying the attention deficits or hyperactiveness on one hand, or oppositional defiant disorders, where the kid actually has a lot of issues controlling his emotions and end up in bullying the other kids, his colleagues or peer group, which is also a very disruptive in his thought process. So identifying at a very root levels and seeing the emotional components closely by a detailed evaluation of his mental stability to his medical awareness. This creates a lot of understanding, and this aids the kid to pass his cognitive phase to a social phase milestone in a well transitioned way. So viewers, and the take home message to the parents is, you should be able to understand the kid patterns in their emotional reactions with a lot of parameters, like how they are able to maintain the eye-to-eye contact, and controlling the temper tantrums is good, but to not suppressing to a point where the kid wouldn't actually express his underlying conflicts is also another issue. So parents should use a lot of parameters in identifying their kids' emotional reactivity, their understanding about the cognitive ability to understand the situations and the reasons behind their tantrums and the reasons why they have this post-scholastic performances, analyzing their intellectual capacities with the time, and taking a clear comprehensive view from both the peer group as well as the teachers as well as academic administrator is much important in actually evaluating these emotional problems in the kids. So thank you so much for patient listening, and have a great day.
Subscribe our YouTube channel to watch more videos.